helping people of all ages in healthcare and in private practice. As an advocate by nature, she founded the BC Aphasia Centre and was president of the Canadian Women's Voters Congress. And it's thanks to Jennifer that we had Jody come out and speak with us this evening. So thank you for organizing that. After developing severe facial pain, trigeminal neuralgia, in 2000, at the age of 50, she was unable to continue work. In 2011, Jennifer was diagnosed with multiple sclerosis and now continues to play a role as an advocate for people with MS and specifically trigeminal neuralgia. Most recently, she has been a facilitator of one of our MS support groups. And at this time, I'd like to welcome her to the stage so Jennifer can tell us about her journey with MS.
Hi everyone. I'll tell my story. There's a little bit of a discrepancy with the dates that Marilyn gave you. But I'm going to start off with an interesting episode. On November the 14th, 2012, I was in my doctor's office on my knees, screaming, in pain, literally screaming. Simple things like brushing my teeth and eating were so painful. And those simple things that led to the pain was like being stabbed or cut in my face, along with electric jolts all the way up to the top of my head. I couldn't even kiss my husband without getting shocks in my lip and in my face. I wanted to die. I told my doctor that if I were an animal in that much pain, I would be put down, and it would be an act of mercy. She explained to me that she would be admitting me to the hospital for help under the Mental Health Act. I didn't care. I needed help. I asked her to send me to UBC because I had an appointment scheduled the next day at the MS clinic. We called a cab, and I arrived at UBC's urgent care, where they don't ordinarily admit. But fortunately, the doctor who saw me was very interested in pain. He called a female neurologist who recommended that I be admitted, and she explained MS-related trigeminal neuralgia to him within my earshot, and luckily there was a bed available. The next day, I was officially diagnosed with MS based on my history, my presentation, and the viewing of the little CD copy I had of my own MRI scan from a few months before. The MS neurologist suggested that I be put on Dilantin by IV, and Dilantin is an anti-seizure medication, and in a couple of days I was out of pain. But I ended up being allergic to Dilantin and the other most effective drug known as Tegretol. So 6 weeks later, I flew to Winnipeg for emergency surgery, a procedure called a rhizotomy, where they damage the nerve so it stops interfering with your brain's ability to interpret the signals it's receiving. And on December 27, 2012, I was finally out of pain and able to eat. I had been suffering from trigeminal neuralgia since June of 2010. It's a horrific pain experience with sensations of cutting, stabbing, burning, aching, electric jolts to the face. And my pain triggers were all in my mouth, mostly eating and brushing my teeth. And even taking medications by mouth caused me pain. I knew it was possible that it could be related to MS, even though it only occurs in about 2 to 4% of people with MS, so it's relatively rare among the MS population. A year after the onset, in July 2011, I saw an experienced senior neurologist who was an expert in facial pain. He decided that the source of my pain was unknown, as my neurological exam was normal, and my symptoms that I described were unusual. But he did put in an order for a non-urgent MRI that was scheduled for a full year later. And I could spend a lot of time telling you about the pain and suffering I experienced over the next 16 months. I was in the hospital for 10 days with malnutrition because I couldn't eat without pain. But in the hospital, they concluded that I was mentally ill. And you see, because I had already been seen by a top neurologist, they didn't refer a neurologist, so they didn't do a consult with a neurologist. But they did ask a lot of psychiatrists to see me, and none of them could identify a mental illness. Regardless, when I was back at home, I was laughed at by my GP. He accused me of looking for sympathy and pretending that I had pain. I continued to be ignored by the neurologist as I pleaded for help with pain, or at least some way to find out what was causing the pain. As I reflect back on that time, I marvel that I'm still here. I'm still here on this planet, and that I'm actually here talking to you tonight. These were very difficult days for me and for my husband, with some experiences that are too horrific for me to relate. But I do want you to know that MS is a truly terrible disease. And getting a diagnosis was the first step in taking my life back. So you may look at me and think that I'm lucky, and in many ways you'd be right. Because I can walk, I'm pretty strong, and I can wear heels. I can get by without people knowing that there's anything wrong with me, and this includes most medical people. And so far, only the most skilled clinicians are able to detect any subtle changes. Right now I work as a volunteer patient, and I've been evaluated by many medical people, and I challenge them to figure out my diagnosis. Most of them need to have the history before they're able to conclude what I have. But before I was actually diagnosed, I had this horrific pain to deal with, but I needed to be persistent, and I needed to hold on to get help. And I really needed to believe in myself and fight. And speaking about it, because I never want what happened to me to happen to another person. After the hospitalization, that was in late 2011, for severe malnutrition, where I weighed 109 pounds. My arms were skinny. It was a terrible, terrible place to be. I needed to assemble a team of supports. I continued with several alternative therapies, including chiropractic, acupuncture, counseling, and the best move I made was finding a new GP. So that when I had MRI results confirming MS, I asked her for a referral directly to the MS clinic here at UBC. And then I joined the MS Society. I went to a newly diagnosed workshop, even though I wasn't officially diagnosed yet. I joined a self-help group where I had a place to cry, to be understood, and to learn. And I waited for my appointment where I was finally diagnosed. After the pain was gone, I continued to do my research and reading on how to manage the disease. My professional background was speech-language pathology, and I used to work at GF Strong Rehab Center. At GF Strong, we believed that the patient and the family were the center of the care team, and we believed that the lived experience of the condition was real expertise. We were good listeners and problem solvers. And now it was my turn to be my own case manager. I read about the newest oral medications, and with my neurologist, we made a decision to try Tecfidera, and I'm still on Tecfidera. And if I were the expert in my own case, then the same was true for every other person living with MS. And I knew that I could tap into that while I made decisions about how to proceed. And many people I knew offered to connect me, like everybody knows somebody with MS. So I had a chance to start interviewing people, and each one had found their own way to manage their disease. So I added some vitamin and mineral supplements to my daily routine, and I followed the examples of other women who are doing much better now than they were a few years ago. And these two women both had what they call secondary progressive MS, and which means that you are really supposed to do nothing but decline. But I thought I'm going to try what these two women have done. And one of them is the diet and lifestyle recommendations of Dr. Terry Walls. She's a physician in the US who has MS and who has regained lost function. And with the help of the MS Society, I'm now facilitating a support group for people with MS to learn more about the approach that Dr. Walls has researched and created. I arranged a meeting with a local woman, Lori Batchelor, who's here tonight, who's made measurable and observable recovery with the CCSVI procedure, and that's the vein opening procedure to improve the blood flowing out of your brain. And she has her whole history documented with video. So last year I went to California to have the vein opening procedure myself. And then I bought a new bike. It's a lavender bike, I love it. And cycled throughout the summer. And my friend Dinah Belotis, who unfortunately isn't here tonight, she encouraged me to join a program through Vancouver Coastal Health. And it's a program called Healthiest Winter, and it's for strength and fitness training. Finding reasons to hope can be the biggest challenge when you have MS. And I'll tell you what gives me hope. The kindness and care of my current healthcare team, the love of family and friends who support me, knowing that there is diverse research occurring all over the world, meeting young and enthusiastic researchers tonight here and at the Brain Research Center, including our WAMS-funded researcher, Dr. Corey Law, and seeing all of you here tonight. Thank you.